Although there's no coffee break, I think we really welcome the next speaker to continue with our lectures. The first speaker will be Professor David Cranston. And he really do not need introduction in Chongqing HIFU because he has been here helping the development of Chongqing HIFU. Now, he is the Associate Professor of Surgery and the Honorary Consultant in Urology Surgery. And the contribution to HIFU is that it helped the HIFU to do the research, clinical research in Cambridge University. So that's why it first started with his support and until we are now reaching this stage. So without further delay, we'd like Professor David Cranston to give his lecture.
This is the wrong presentation. George, this is the wrong presentation. This is not the one I sent. This is not the presentation I sent. I sent two. The first one was, this is the first one, which is not the correct one.
Is it okay to so I think it's...
So, yeah, I'm sorry, but I had an updated presentation, and this is, which I sent, but this is an old one, so, but we will go with this. So I have been for many years to Chongqing, about 25 years, and it is a great pleasure to come back. So we have many good buildings in Oxford, and this is called the City of Dreaming Spires, and we have lots of art in Oxford. So if any of you visit Oxford, we would love to show you around. So William Osler was a very famous physician in Oxford who started in Canada and then in one of the founding fathers of Johns Hopkins in America and ended up in Oxford. And he said, diseases that harm require treatments that harm less. And he was born in Canada, the son of a priest, and was very good at school, initially wanted to become a priest, but then he changed to medicine and was qualified in 1972. I will skip through some of these because this is the history of William Osler, but it is quite interesting. He did a lot of his own presentations and his own dissections. And as I say, he was one of the founding fathers of Johns Hopkins and married late in life. And sadly, his only son was killed in the First World War. But he taught the students at the bedside. He was one of the first doctors to take students to the bedside. And he had many very good quotes, like medicine is learned at the bedside and not in the classroom. And he was more interested in the patient who had the disease than the disease that had the patient. And I think we need to be careful these days with all the technology that we do not concentrate too much on the technology and ignore the patient. And he wrote the very famous book called The Principles and Practice of Medicine. And this was translated into Chinese. There are still some copies in some of the libraries in China. He had many very good quotes And he said that it is important to look both at the patient but also at the books. And he finished up living in Oxford. And this is a picture of his house in Oxford. And here we are with President Zhang and President Lang when they came to visit some years ago. And he had, like many of the great Chinese leaders, care and compassion and science. And the true traits of a doctor are like that of a commander: courage and wisdom and humanity and integrity. And for many years I was a surgeon, and surgeons learned their skills in war. And here was the first demonstration of anesthesia in 1846 in America. But like this, the aeroplane, which we know is so important, I had a good flight 2 days ago on the aeroplane. But when it started, they thought it was useless, and some people have said the same about HIFU. I started as a surgeon. This is a picture of, I was a urologist, spoke most of my life operating on kidneys for kidney transplantation and complex kidney surgery. This is a surgery of a kidney where the tumor grows into the vein and up to the heart. This is a part of the tumor in the heart. So we did major surgery with the cardiac surgeons to take the kidney out and the tumor out of the heart. I avoided laparoscopic surgery, I avoided robotic surgery to go straight to HIFU. And we have been working now for 25 years with HIFU here, and it has been a great collaboration. This was the first machine we had, and in this building here, and this was the JC200. We have just had that upgraded in the hospital. Unfortunately, this is not all HIFU. This is the new hospital in Oxford, but we have a room in there for HIFU. And we all know about this, and that if you put the power up 10,000 times, you can cause a burn. And we have been enjoying working with HIFU over many years. So here, if this, I'm not sure if this works. So here we have the plastic sheet with the, here, very hot melting of the plastic, and here just focused on the water. So this we have had great joy in using. And here we see with this phantom the lesion being created here. And this was an early ox liver, which we were just demonstrating to the people in Oxford about. And my colleague Gail Tahar showed this demonstration between the live and the dead tissue. And this is my colleague who set up the HIFU with me, James Kennedy, a surgeon in Oxford. He has changed course now. He is now a priest in Oxford, but he wrote this landmark paper for Nature in 2005 after the work that we'd done on the HIFU unit and had it CE marked for Oxford. And these are the trials that we've done over the years. And Okay.
Or you can skip it to that page.
Oh, yeah.
Exactly.
Okay. So shall we just?
Yeah, you can slow down. You can.
Or shall I stop? Or okay. So I think they have found the presentation that I wanted to show. So I will just go a little bit more slowly because I have some updated slides that we will be able to show. So let me tell you anyway about our early trials. So we started off back in about we had the first Chinese machine in Oxford in 2002, and we had the first machine from Chongqing in the Western world. So the important thing for us to do to start with was to get it CE marked so that it could be used outside clinical trials in the UK, in Oxford, and for the whole of Europe. So we looked to start with at liver cancer and kidney cancer. And in 2005, we had this approval for the CE marking for Europe. So here's I show this picture, young Zibia Wang, who has been my Chinese brother for many years. We have both got older. So this is the new machine which we have in Oxford, which was just installed a few weeks ago, thanks to the Chinese engineers who came to do that. So these are the trials that we have been doing in Oxford over the last few years. You don't need to look at that because I will go through them in a bit more detail. So these are the other treatments that we have had with the fibroids, a renal transplant, and skin metastases from colorectal carcinoma. Occasionally, you get these little blisters on the skin, but very safe. And this, as I say, was the CE mark. So with the kidney, for the trials, we looked at about 17 patients. We looked at the HIFU, and some of them had surgery afterwards, just to show the effect of HIFU, and some we just followed radiologically. Here is one that we successfully treated, and you can see the lack of contrast uptake, and this was also after, even after 5 years with good treatment. But we have a problem with kidneys. One of the problems is the fat on the kidney, and one of the problems is the ribs. So we did experiments to look at the fat on the kidney, and when I was taking a kidney out, we took the fat around it and looked at the HIFU for the fat. And we found that as the fat gets thicker, so it absorbs the HIFU. And if the fat is 5 centimeters, then only 1/4 of the energy gets through to the kidney. So that is one of the problems with kidneys, and the other problem with kidneys is the ribs for getting. When you do a kidney transplant, you take the fat out of the kidney and you put the kidney in the groin, and what that does is it means that it's much more accessible for HIFU. This was a tumor in a kidney transplant, which we treated with HIFU. And I then did an operation to remove the tumor, but after HIFU 90% had been destroyed, The only thing that remained was a little bit around the edge because we had been careful not to treat all around the edge. We didn't want to damage the normal tissue. This is another trial that we did looking at sacral chordomas, which is a malignant tumor of the sacrum. It's quite rare, but it is locally invasive. And this is a picture. This was a patient who had big tumors and was unable to sit down. And we treated on 2 sessions with HIFU, which showed that the blood supply had been removed and it gave them great symptom relief. And we wrote this up in the British Journal of Neurosurgery in 2017. We've also been doing some work on the pancreas recently. We had 2 trials on the pancreas, one just ablation of the pancreas looking at the immunology, and that is still ongoing. We were hoping to do targeted drug delivery in the pancreas, and I'll explain that in a minute. Sadly, COVID meant that that trial did not start. But this is some treatment of the pancreas, which is certainly very good for pain of pancreatic cancer and some possibility of cure. And my colleague Gail Tahar, who some of you know, who is basically the leading HIFU physicist in the Western world, looked at a review of 3,500 pancreatic cancer patients, many treated here, and found that it was feasible and safe and possibly cause some improved survival rates. So I think a lot more work needs doing on that. It is a different machine that we use for treating prostate HIFU. I will not talk a lot about that, except that it is approved in the UK, and I think it's now FDA approved in the US. And so it's used in Europe, and increasing studies show that it is as good as other localized treatments. And we are also looking with our pancreas study at the possible immune response and the immune effect of HIFU. And it's possible that with other things like histotripsy, cavitation, and so on, that it's possible that you may be able to develop anti-tumor antibodies. But this is an interesting line of inquiry. So my colleague, Paul Lyon, who is now the director of the Oxford HIFU unit, a radiologist, did his PhD on targeted drug delivery. So you can put chemotherapeutic agent, doxorubicin, into liposomes. Liposomes are like butter. They are stable at 37 degrees centigrade, but at 42 degrees centigrade, they break open to release the drug. So basically, what he did was looking at colorectal secondary cancer in the liver, looking at how you increase the dose of the drug directly into the tumor using this method. So basically, take a biopsy of the tumor just to confirm that it is a cancer, and then you inject into the peripheral circulation this drug, Thermodox, and then you heat up the tumor with ultrasound, HIFU, slightly non-focused beam so that you're not actually ablating it, but you're heating the whole tumor up to 42 degrees centigrade. And then what happens is that you then look at the result radiologically, and found that as the drug goes through the tumor, at that temperature, it breaks open and releases the drug, and you get a 2 to 9-fold increase in the drug, in the tumor. So here we can see after treatment, you have this destruction of tumor with increased drug delivery. And they looked out of 9 patients and showed a very good increase. And he wrote this up, first study that was being done in man, in humans, and wrote that up for The Lancet in 2018. So we're talking a lot about fibroids this meeting, and here's one that we treated in Oxford. But we were involved in helping this 20-centre China study with writing it up for the British Journal of Obstetrics and Gynecology under this framework by Peter McCulloch called the Ideal Framework for Evaluating Surgical Innovation, the idea, the development, the exploration, then the assessment, and then the long-term follow-up. And the 20 participating centres in China, 2,400 women, and this was looking at complications, hospital stay, return to normal activities, and 1,350 had HIFU, 400 hysterectomy, 500 myomectomy. And HIFU, which was shown to be just, if not better, than the other treatments, but less in the way of adverse effects and less in the way of hospital stay. And as a result of this and some of the studies that we did in Oxford, we were able to get fibroids approved by NICE, the National Institute of Clinical Excellence in the UK, for allowing us to treat fibroids clinically. This was just a very small study that we did in Oxford with some patients, just showing basically same results. So our NICE interventional procedure guidance was accepted for fibroids in 2019. So congratulations to Chongqing HIFU. We were made a Centre of Excellence by the Focused Ultrasound Foundation in 2023, and Chongqing HIFU was made a Centre of Excellence by the Focused Ultrasound Foundation in 2024, which is a great achievement for Chongqing HIFU. And I'm delighted, despite some of the political tensions we have between the West and the East, I'm so delighted that on the medical side, we are very able to collaborate and be friends across the world. I think HIFU is wonderful for bringing everybody across the world to be friends together. Maybe some of the politicians should learn from that. I don't expect you to look at this, but this is on the Focused Ultrasound Foundation website. And basically it shows the huge possibilities for HIFU in the future. And you may be able to see the different colors. The purple is what is reimbursed, quite a few approved, many pivotal trials, a lot more pilot trials, and an awful lot of preclinical. So the future for HIFU is wonderful, I think, and we look forward to it. My colleague Feng Wu with Gail have just written edited this book on HIFU. And many people in Oxford, as well as in China, have collaborated with us, and it has been a great joy to collaborate over the years with Chongqing. As I say, I think I've been out to China about 25 times now, so it is almost my second home. I'm sorry I have not learned the language. Here are some of the people that we have collaborated with in Oxford. And I just point out, so Fung, who's been with us for 25 years, has been fantastic. And Professor Konstantin Kusios is Professor of Biomedical Engineering, who is doing an awful lot of the preclinical work on this. So it's been a great joy to be back here, and thank you for listening.